Hey there and welcome back to my channel. On this channel, we discuss mental health topics with a focus on borderline personality disorder and dissociative identity disorder. My name is Shell, and today we're going to be getting back to basics with borderline personality disorder, or BPD. I do have notes that I'm going to be referencing because if I didn't use them, I would lose my place and start rambling. So, what is BPD? The DSM defines BPD as a pervasive pattern of instability of interpersonal relationships, self-image and affects, and marked impulsivity beginning in early adulthood and present in a variety of contexts. So essentially, you're looking at instability of relationships, how you view yourself, and your mood. And this behavior is not limited to specific situations. There are 9 diagnostic criteria for BPD, and you have to meet at least 5 to receive a diagnosis. These criteria are frantic efforts to avoid real or imagined abandonment, a pattern of intense, unstable interpersonal relationships with alternating extremes of idealization and devaluation. Now, this is not limited to romantic relationships. This also includes friendships and relationships with your family. Marked and persistent unstable self-image or sense of self. Impulsivity in at least 2 potentially self-damaging areas, recurrent suicidal behavior and or self-injury, instability and marked reactivity of mood, chronic feelings of emptiness, inappropriate intense anger or difficulty controlling anger, transient stress-related paranoid ideation or severe dissociative symptoms. In addition to meeting at least 5 of these criteria, these symptoms must cause significant distress in multiple areas of your life. Now, this information does come from the DSM-4. The DSM-5 does take a different approach in identifying personality disorders, but the information I've been able to find is pretty confusing. So I will make a video sometime in the future looking at the differences between the DSM-4 and the DSM-5 once I've gotten my hands on a physical copy of the DSM-5 and have been able to read through it myself. In the meantime, the 9 criteria still seem to be widely used, and it was how I was diagnosed 2 years ago. There is some controversy with the BPD diagnosis. In my experience, therapists tend to think that BPD is overdiagnosed, especially in young women. And I think this probably contributes to my own history in the mental health system, where off and on I would have therapists saying, yes, you do have some BPD criteria, or no, you don't demonstrate BPD. And it really just depended on the therapist's perception of the diagnosis. However, the research does show that it may actually be underdiagnosed in the general population. I think the disconnect lies in a lack of understanding among professionals. Unless a therapist specializes in personality disorders or trauma-informed therapy, they are often ill-equipped to properly identify borderline personality disorder. There are even more complications when you look at the number of comorbidities and misdiagnoses. BPD is often comorbid with depression or bipolar disorder, anxiety, PTSD, and or other personality disorders. BPD is very often misdiagnosed as bipolar disorder. Alternatively, a BPD diagnosis can hide dissociative disorders such as DID, or may be more appropriately identified as complex PTSD, which is an emerging diagnosis that has not yet been included in the DSM. There are also a number of ways BPD can present. 2 people with BPD may not be anything alike. Additionally, the ICD, which is the diagnostic tool used outside of the United States, allows for the characterization of the severity of the disorder using mild, moderate, and severe. There are also subtypes of BPD that have emerged in the research over the past several years, although it has not yet been included in the diagnostic manual. BPD is a complex disorder, but one thing that is agreed upon is that it is a very painful disorder to live with. It is highly stigmatized and often demonized by the media, but it is a treatable disorder, and it is my hope that I can contribute to its understanding by sharing my lived experience. So I hope that you have found this valuable. If you have any thoughts or questions, please leave them below in the comments. And until next time, take care and stay well. Bye.